Welcome back to On the Beat. Isaac hosting again this week, and I have with me Drs. Gillespie and Hurd from Gastroenterology Associates in Columbus and Starkville. Doctors, appreciate you again spending some time with us on a hot afternoon.
Yeah, thanks for having me here.
Excellent. In our air-conditioned studio, today we are going to talk about colitis. I guess I'll start with you, Dr. Gillespie.
Yep.
What is, you said in the break, it's a broad term, I guess?
Yeah.
So.
You know, colitis just means kind of inflammation. So colitis is just inflammation of the colon, and that can be due to a lot of different things. It could be due to infection, any sort of bacteria or virus can cause it. It can be autoimmune, things like Crohn's or ulcerative colitis. It can be due to medications that you take. So basically, you know, it can be due to a lot of different things.
Sure.
So it's a kind of a general term.
On a different segment, you mentioned bacteria in the intestine. Some was a good thing. Is this something completely different, I guess?
There are certain bacteria that are bad
Okay.
that can cause symptoms that are different than the good bacteria that we
Sure.
have. And so those things can cause colitis if they kind of take over.
Okay, so say you find colitis in a patient. What are some of the symptoms that he or she may present?
Stomach pains, one. Bleeding is another one. Diarrhea is another one. You may, depending on your age group and a lot of different factors, we'll have a better idea of what's going on when you come to us, and then we'll help you work through some of those causes.
Is there a specific age group that is more susceptible?
Well, for different causes, yes. So like, in our older community, they may be more susceptible to ischemia, that's decreased blood flow
Okay.
to the colon, and that would cause colitis. They're more susceptible to certain types of infections, and so we would be more suspicious of that. And our young people, we're talking more ulcerative colitis and Crohn's disease, although old people can get those too.
Okay.
But yeah, the age groups matter a little bit.
All right, so what causes, I guess you kind of already touched on it, but sort of the overall cause of something like that?
So anything that causes inflammation in the colon, it can be just minor inflammation where you have a little bit of diarrhea. It can get really bad where you have ulcers and bleeding and other things on the inside of the colon.
Okay.
But really, it's something attacking the lining of the colon, causing this inflammation and bleeding and diarrhea and things like that.
Whatever that may be.
Yeah.
Yeah, I think the one that we get the most questions about is ulcerative colitis and Crohn's disease. Those are more of the chronic diseases that affect a lot of our younger people in their kind of lifetime problems. And so what happens in those, it's very interesting. We don't know exactly what happens, but your immune system is attacking something in your colon. And, we think part of it could be something to do with your normal flora, those bacteria that we were talking about that
Sure, the
grow
good
and
kind.
live, the good bacteria.
Yeah.
There may be something that goes a little haywire with those, but there's lots of different theories. But with those, your immune system is attacking you. If we find the good medicine or the good cause for those, then for most of these things, we got good treatment for them.
Okay,
too.
yeah, that's what I was going to get to. Sounds kind of scary potentially, but is there hope? Is there treatment, I guess, right?
Sure.
A lot of times it'll get better on its own.
Okay.
Sometimes we will give antibiotics just in case it's infectious. Things like Crohn's or ulcerative colitis generally can get better on their own, but generally require some
A little help.
medication because it's more of a lifelong disease. But a lot of times, if it's just mild, it'll kind of resolve on its own.
Okay.
But certainly, with any bleeding or anything like that, we'd like to, do a little more investigation.
And maybe a separate treatment. Is there any other treatment besides antibiotics?
Yeah, so, antibiotics are infectious. So, you got an infection, you got a bug, we give you antibiotics, and that's easy.
Sure.
But, the really interesting thing right now that's going on in medicine for us is all these new medicines that are coming out for Crohn's disease and ulcerative colitis. So, we've taken some really bad diseases that have caused people really bad problems for years, and now we have some really good treatments, and we can get most people under control with those.
Excellent.
now.
Well, that sounds encouraging and sounding hopeful, especially some of the new treatments. Doctors, we appreciate your time this afternoon. If you have any additional questions or need any additional information, the information you need is listed on your screen. We'll be back after this.